Hello, my name is Farah Rohoman. I am one of the board members of the Children's Health Foundation Board of Directors. As a board member, I do sit on a number of different committees. So I'm actually the first vice chair of the organization for our board. I sit on our executive committee, and I'm also the chair of our grants committee, which is one of the groups that takes a look at the grants that come into our from our different healthcare partners. And in addition to that, I started out at CHF as a volunteer on our governance committee, and so I continue to do that. In my day-to-day life, I am actually a lawyer. I work for Miller Thompson here in London, Ontario. I am a corporate lawyer where I do various corporate transactions for our clients both in London and Southwestern Ontario. So I got involved with CHF through the governance committee to sort of get my feet wet and see what things were like. And it sort of fit well with my background as a lawyer. And so on the governance committee, I've now sat on that committee for a couple of years, and I primarily take a look at any sort of governance issues that come up that the board of directors or the organization want us to take a look at and make sure that we are complying with our obligations, both from a legal perspective, to our donor base, and to our healthcare partners. You know, the governance one it's one that's an important one to the foundation, that is important to me and I think the group, to help us make sure that, you know, we have accountability to our donors and what we're going forward with. Our grants committee is the committee that takes a look at various grants requests from our three healthcare partners. It's something that happens on an annual basis where the organization sends out a request for funds to our three partners. They then submit all these wonderful proposals of things that they want to do in the upcoming year. And then the committee then reviews all of these requests. We help vet them. We help ask questions to make sure that the different grants being requested align with the objectives and our, mission statement of the foundation. And that, they are things that we can actually grant for. So we do a lot of evaluation that way. It's a very rewarding committee to sit on, because you get to really see where the potential dollars are going to go and how we're actually going to impact our, the various stakeholders and the children that their programming will actually, touch. So that would be the grants committee. And then at the, I'm new to the executive committee this year. And really what that is, it's just a group of board members who meet on a regular basis in between our regular board meetings. So that way, if there's questions that come up from the organization or things that need to be dealt with sooner than a board meeting might be scheduled, that group can take a look at that. And there's certain procedures in place that we might be able to approve something if need be. And then the last of it really is just being a board member, and maybe it's not the last, but maybe one of the more important ones is being a board member. And really the board members, what I think is probably very rewarding, because we get to see all the different aspects of the organization from a strategic perspective, some of the bigger pieces that the organization is doing, but even just some of the smaller things. We get to hear all these great stories about what the organization is doing and how it's helping the London community. And really at the board level, what we do is we help guide the organization in terms of questions they might have, different ways we can move forward on things and help steer the foundation as we go forward into the future and all the different things that they're doing. So the CHF is the first board that I have volunteered with, not one of the first organizations that I've done sort of committee work for, but it is the first board that I've sat on. But I think really what drew me to CHF is just throughout sort of my whole career, and even as a student, one of my passions has always been towards helping children, whether in whatever capacity that might be. So I tend to go towards organizations that have some sort of philosophy towards assisting children, whether it's education-wise, healthcare-wise. And so CHF really just fit with the types of things that I'm passionate about and giving back towards. And so, starting on the governance committee and getting involved that way was a great start. And then, as I got to know the organization and realize what a great impact it makes on the whole Southwestern Ontario community and our, our different catchment regions, I really thought to myself, this was a great organization to continue to be involved with, and that I could help, at least provide some assistance or, whatever I could to help at the board level. And so I was happy to take that position on as well. And so really that's really what drew me to CHF. And then as you get more involved and you learn the mission and all the great things they do, it just inspires you to continue on and to keep volunteering. So one of the things I really like about volunteering with CHF is the direct involvement that we have with the staff as well as with the healthcare partners. So you really get to see sort of the totality of what the organization is doing and how your contributions help shape what the foundation can do and give input that way. So, on any given time, whenever I'm interacting with CHF and the staff members, you really, they are very grateful for the time you put in. I think they really appreciate the input that we give from a third party perspective coming in and sort of seeing things rather than just sort of being boots on the ground all the time. We can kind of take a step back and, offer some different perspectives, and also just your different experiences in life and different businesses and things like that sort of help give some guidance that way. And then I really also enjoy that not only do we get at the board level and at some of the more in-depth positions that I've had on various committees, you do get to be involved with the different healthcare providers and getting to see where the dollars, where they're going, how they impact the actual beneficiaries of where the funds are going and our children and things like that. So I really enjoy that part of it. It's not just sort of a position where I come in and offer just some information. I actually see where that information and how that all unfolds over time. I was thinking about this question leading up to this, and it's amazing how much that has been accomplished in the last couple of years. I don't know there's a specific item that I would say is the biggest accomplishment, because the organization is growing and there's so many different things that it's moving towards and doing. So, I can think of a couple of big items that I've been involved with. For example, we've just gone through our strategic planning. And so that was pretty exciting to see that and how that was unfolding and the plans for the future for CHF and where it's going to go as it progresses and sort of the different milestones that we're going to achieve. I really also enjoy, in the last, notwithstanding COVID and things like that, people have been very generous and very helpful with CHF and really appreciating that our children have been impacted. So it's great to see that donors are reaching out and continuing to do that. So that I think is really, that's really maybe not a credit of me, that's a credit of the foundation and all the things that it does. And so I really enjoy that part of it. And the other thing that I'm always amazed at, so sitting on the grants committee, every year I get to take a look at the grants with the rest of the committee, and, we get to say yes pretty much all the time, but most of the time we get to say yes to all these really great grants that the healthcare partners provide, or we get to sort of evaluate that. And I really, I can see that would make a tangible difference in the community. So I think that's, on an annual basis, that's what I'm really proud of, is being involved with that annual selection for grants. Definitely, I think CHF has helped me develop empathy. Before you know that there are children in our community that are suffering various challenges, and that, it varies depending on what their situation may be. But until you sort of start, if for example, in my situation, I don't yet have children, and so I don't directly deal with that, and getting to be able to see how are, these different situations in the community and those stories coming back to the foundation, coming back to the volunteers, and then seeing what our work then does to help change or impact or make things better. I think that really helps with my empathy towards the different situations that people are going through. Makes me think about what those folks might be, those challenges that they might be going through, and how we can make a difference that way. So I think I always tell people that, the first reason that anybody should volunteer for is because you should believe in the cause. It shouldn't just be for adding something, else in your day. To me, it's really, you got to believe in what the organization does. And I think the group of people that CHF work with as the staff, the healthcare partners, and all the volunteers, I think we all really believe in the mission and the vision of CHF and all the things it does. So I think that's probably the key. And I think what you find is everybody then who's involved with CHF, doesn't matter what level, what stakeholder, whatever the case may be, because they really believe in it, everybody's really passionate about it. And so we enjoy working with one another. We enjoy, chatting with one another, helping things move forward. And I think that's really what draws me towards this is, working with a really great group of people for a really good cause, various causes for all three of our healthcare partners. And to me, that's what continues to make me come back. I've been doing this now probably at least 4 or 5 years at this point in time, prior to me joining the board as I was a committee member. And I continue to sit on other committees for the organization and continue to give my time, because I really think it's an important thing to do, and I'm happy to do it.